Obesity. In this video, we are going to see about obesity. Obesity or overweight is a condition of excess fat deposits. Obesity is a chronic complex disease defined by an excessive fat deposits that can impair health. Obesity can lead to increased risk of type 2 diabetes and heart disease. It can affect bone health and reproduction. It also increases the risk of certain cancers. Obesity influences the quality of living such as sleeping or moving. The diagnosis of overweight and obesity is made by measuring people's weight and height and by calculating the body mass index, which is calculated by weight divided by height square. The BMI categories for defining obesity vary by age, gender, infants, children, and adolescents. For children, age needs to be considered when defining overweight and obesity. For adults, WHO defines overweight and obesity as follows. Overweight is overweight for a BMI greater than or equal to 25 and obesity for a BMI greater than or equal to 30. About 16% of adults aged 18 years and older worldwide were obese in 2022. The worldwide prevalence of obesity more than doubled between 1990 and 2022. In 1990, the children obesity is around 2%, whereas in 2022 it has been increased to 8%. Causes. Overweight and obesity result from an imbalance of energy intake and energy expenditure. The individuals become obese because of unhygienic and unhealthy eating habits, reduced physical activity, stressful lifestyles, and other factors. In most cases, the obesity is a multifactorial disease due to obesogenic environments, psychosocial factors, and genetic variants. In a subgroup of patients, single major etiological factors can be identified. At the same time, the lack of an effective health system response to identify excess weight gain and fat deposition in their early stages is aggravating the progression to obesity. The obesogenic environment exacerbating the likelihood of obesity in individuals, populations, and in different settings is related to structural factors limiting the availability of healthy, sustainable food at locally affordable prices, lack of safety and easy physical mobility into the daily life of all people, and absence of adequate legal and regulatory environment. Health consequences. In 2019, higher than optimal BMI caused an estimated 5 million deaths from non-communicable diseases such as cardiovascular disease, diabetes, cancer, neurological disorders, chronic respiratory diseases, and digestive disorders. Being overweight in children and adolescents affects children's and adolescents' immediate health and is associated with greater risk and earlier onset of various non-communicable diseases such as type 2 diabetes and cardiovascular diseases. Health consequences. The child and adolescent obesity have adverse psychosocial consequences. It affects school performance and quality of life, compounded by stigma, discrimination, and bullying. Children with obesity are very likely to be adults with obesity and also at a higher risk of developing non-communicable diseases in the adulthood. The economic impacts of the obesity epidemic are also important. Many low and middle income countries face a so-called double burden of the obesity. While these countries continue to deal with the problems of infectious disease and undernutrition, they are also experiencing a rapid upsurge in non-communicable disease risk factors such as obesity and overweight. It is common to find undernutrition and obesity coexisting within the same country, the same community, and the same household. The children in low and middle income countries are more vulnerable to obesity and overweight. At the same time, these children are exposed to high fat, high sugar, high salt, energy dense, and micronutrient poor foods, which tend to be lower in cost but also lower in nutrient quality. These dietary patterns, in conjunction with lower levels of physical inactivity, result in sharp increases in the childhood obesity, while undernutrition issues remain unsolved. Prevention and management. Overweight and obesity are largely preventable and manageable. Some of the preventive interventions of obesity are support behaviors of children around healthy eating, physical activity, sedentary behaviors, and sleep, regardless of current weight status, and limiting the screen time. The consumption of sugar sweetened beverages and energy dense foods and promote other healthy eating behaviors. Enjoy a healthy life such as healthy diet, physical activity, sleep duration and quality, avoid tobacco and alcohol, emotional self regulation. Limit the energy intake from total fats and sugars and increase consumption of fruits, vegetables, legumes, whole grains and nuts. Engage in regular physical activity. The dietary and physical activity patterns for individual people are largely the result of environmental and societal conditions that greatly constrain personal choice. Obesity is a societal rather than individual responsibility, with the solutions to be found through the creation of supportive environments and communities that embed healthy diets and regular physical activity as the most accessible, available, and affordable behaviors of daily life. Thank you.